if that's helpful.
That explains it.
Equipment, is Whitman-Walker up to speed on digital equipment and some of the new?
Well, we don't do them here.
You
You see,
said
we
that,
actually
okay.
don't have the facility to do that
Understood.
here. You know, we don't have a radiology department. I mean, it's something we're talking about.
They used to have
but-
the GW. What happened to the GW breast?
The mammograph.
Yeah, because
the
you-
mammograph still.
It
Yeah.
comes both here and to Max Robinson and other
Yep.
community sites. And it's GW is great. You know, they're all everywhere
Yeah.
in the city. We're so lucky to be in DC that pretty much
Right.
everybody's all up on the brand new
Right.
But
stuff.
that is an interesting point. Let's talk about what Whitman-Walker does provide and what you send out predominantly.
What do we do
What do
provide?
you refer out? What do you do here and what kind of women's services do you have to refer out?
Okay, well, we can do primary care, so that if you wanted to come in and have a general checkup, not just GYN, but have a primary care provider here, you know, for your whole healthcare needs, you can come in here and have a complete general physical and get blood work done.
With your insurance.
Yes,
Yeah.
I mean,
I'm
we're not,
that
right,
point because it
that
used
is
to be a
true,
free
we're not a
clinic.
free clinic
True.
anymore,
So
that
you
is
can-
true. But we do have a big public benefits department that actually will assess your need, and there's also a sliding scale that is in effect too, depending on what your situation is. But you can have all that done, and then you can also have a GYN exam done as well. Now, we can do colposcopy here and endometrial biopsies. We have a gynecologist, Dr. Smith, who's here regularly, who incidentally did work with us back in 1979. She was, you know, a young physician at Howard University Hospital.
She's
and-
still young.
and I was a young PA.
And that makes me
still
young,
young.
too.
and so again, it's sort of like full circle. So she can do procedures here. But if you need to have surgery, if you need to have ultrasound, if you need to, we do have to refer you to, and we have a facility. I mean, we work very closely with Washington Radiology, with Groover Christie Radiology, and we get results pretty quickly, also with GW, so those kinds of things. But you can get your blood work done here, and you can get some of the GYN procedures done here. We have a lot of young people who have moved to town who don't, I mean, this is interesting too with insurance situations. There's a lot of primary care people that don't take insurances anymore.
Right.
All right, so
Especially the HMOs. It's hard to find a primary care that accepts HMOs.
that's correct. Because an HMO, you have to go to,
Yeah,
to
to
a
go to the
specific,
facility.
but even within that, those,
Predominantly,
yeah.
I mean, unless you're a new physician, most of the primary care physicians are closed to new HMO.
in the
patients.
HMO, in the HMO itself you're talking about.
Right. Well, no, I'm saying, so a lot of the established primary care physicians in DC are closed to new HMO patients. They'll take PPO patients, but they don't
They
take.
don't necessarily have facilities. Sometimes you get an HMO, you
Right.
can pick a doctor in the network.
Right, but you have to be, but you're saying even in the HMO networks, and the HMO has its
Right,
own network.
that's
Right,
right.
they
And
might
you're
have
saying
lists and lists and lists of doctors.
in the network.
But
But
probably
nobody's taking
80% of those doctors are not taking new patients.
There you go. Then that's correct. And so if you're picking HMO, you're kind of stuck, because we're not in an HMO, we're not part of an HMO network either. So
I
if
thought you were a part, I
No,
thought
we're
you
not.
took HMO patients.
No, we do not.
That's why I made the little point
No.
on the insurance.
No,
Ah.
no, we're PPO.
Okay, so you don't take HMO.
We don't take
Okay.
HMO. But even for PPO, you know, which is, you can choose on a wider network, there's still a lot of primary care people that are either not taking new patients or not even accepting insurance.
And there's a pharmacy as well, too, here.
Yeah, oh yeah, we have pharmacy services too. But yes, we do take new patients here. Yeah. So, and as I said, we're offering more than just GYN services, we're offering complete primary care. But you might have to get some tests done other places, but the information comes back and we coordinate it, just like.
So I work for physicians, and I have a lot of LGBT friends, and I'm queer myself. So I was really screwed the other day when a friend of mine called in trouble, a transgender M to F person who was having blood in the urine. And it sounded like probably a prostate issue. And they'd had a bad experience at Whitman-Walker years ago and didn't want to come back. But I tell you, I could not find that person another place to go. or anyone that would take them. I called in some favors and got them taken care of over the phone, which didn't make me very happy, but they got taken care of. But I'd like to be able to tell her it's time to come back to Whitman-Walker. It's time to give this another chance. Can you talk a little bit about your health services for transgender people?
We have a huge transgender program, and I have I would say 30 to 40% of my patients are transgender, both male to female and female to male. And so everybody here who sees patients has training in transgender health. So, and we certainly try to address people by their name that they want to be called by. We try very hard to make sure that people feel comfortable, and I think that in any place in the whole city, a transgender person should feel the most comfortable here. And again, there's going to be situations where there's conflict in any situation. I mean, we have some wonderful patients, we have some crazy patients. There's personalities that don't get along. So you could have a bad experience, but I think as far as the whole center goes, I think everyone is very welcoming. We do a lot to encourage transgender people to come in.
And I've told her that it's been an active goal to
Mhm.
improve
That's correct.
transgender services, and I think that is correct.
We even have internal training that new staff participate in on anything from the basics of, the correct gender, name to pronoun to just, cultural competency and customer service. I mean, 9 times out of 10, it's just being polite. It has nothing to do with orientation or gender identity or anything. It's just having a smile and saying, welcome to Whitman-Walker. Sometimes we need to work on that. Don't we all?
Is there a support group as well?
Yeah, we've got a couple different support groups, both for transitioning younger individuals as well as older. Younger, like they're short. I don't know why I had to do that.
Speaking of older, when you were talking about the need for sort of a women-centered space, like places for people to come together, because we used to have that, and we don't have that. We don't have the women's bookstore anymore, and that was true. When Mama's was around, it was very comforting. If you wanted to know what was going on in the city, you could go there, and Jaquetta mentioned, well, now we have the internet. You can find meetup groups, you can find anything you want online, and so it's lost the personal touch.
Right.
So I guess that's something that you could throw out. Is that something that, I think you were talking about feeling the need for that, and that would be a question that we may pose to you, to see what people feel about that. Are there still needs for kind of women-centered places where people can meet and get information?
It's true that from my experience, there's plenty to connect for hookups, but there's not so much to find, you have a conversation about who's a queer-friendly physician, and all of a sudden everybody wants to know the names of who you suggest and who you recommend. I will have to think about that a little bit more, and who I do recommend. I will say that I think it's unfortunate if you guys don't take HMO, because I think a lot of the people that I've been talking to are people in their 20s who have HMO insurance, and they'll need to find places that take their insurance.
Well, I think young people in their 20s don't understand this insurance thing, and HMO is
agree.
cheaper, so they sometimes don't know what they're
And
getting
they think, oh,
themselves.
I'm young, I have no issues.
Yeah.
But
And then
that's
they're
not-
sort of
yeah.
right sometimes.
Well,
It's very
this is
sad.
true.
I want those days when I used to go once a year to the doctor and they would be like, come back next year.
That's right.
Now they're like, we'd like to do a few more tests on blah, blah, blah. Welcome to your 40s.
Yes.
Well, yeah, and there are practices that are test-driven again. I know some practices where you go in and, you go in for a regular exam and you come out with an echocardiogram. It's like, why did I get that? Well, you have to be, there's economically driven. There's that, too.